Thank you, Patricia and Charles. I'm Artie Paul, Environmental Health Specialist at Richmond City Health District. I'm here to talk about food safety for all us employees here at Richmond City Health District. The first thing we need to do, talking about food safety, is to wash our hands. We want to make sure we use hot water. We need to rub vigorously with soap, build up a good lather. Make sure we do that for at least 15 seconds for a total of 20 seconds washing our hands. We want to make sure we get the water off. We go use our single-use towels. We don't want to use our shirts or any part of our clothing to dry off. We want to use a single-use towel and throw it away in the garbage. We also want to make sure that if we're doing dishes, we don't want to have any kind of contamination. If we have or washing dishes, we want to make sure if we have any debris, we want to use a strainer, get a lot of debris out of there. If there's any other debris in the sink, we want to make sure we get it out of the sink to prevent any attractive conditions for insects and the like. Also, the microwave, the same thing. We want to make sure it's clean, and if there's any spills, we want to clean them up, again, to prevent attractive condition. Next, we want to make sure that our food, if we have any food in here, we have a proper label. Well, it looks like this food is properly labeled. It was labeled for today. So, actually, 7 days from this would have to be thrown out because the germs would build up and the food would not be good. We also want to check, make sure there's no spills. Spills are good. If there is any spills, you want to clean them up very quickly, again, to prevent attractive condition. We also want to make sure the temperature in the refrigerator is at 41 or below. The food, we have checked this earlier and we found that the food is 38 degrees, so we're very good. Again, labeling, very important. We have a label here. If we have any food, for example, these French fries, if they were gone today, we want to put the label again. We put 4. Again, 7 days from that day, we need to throw it out. Now, ice safety. We want to make sure our ice is safe because it is a food. You look in here, I'll run low on ice. What we don't want to do is we don't want to pick the ice out, as we can see here. We want to make sure that we use the ice bin and properly dump it out. And when we dispense the ice into our glass, we want to use the tongs because we want to prevent bare hand contact with ready to eat food. Our wish list, also on our wish list, we need to have some wipes. Wipes would help keep the counters clean and reduce the pathogens or the disease-causing organisms on our counters and non-food contact surfaces. That's an extra thing to use. And remember, hand sanitizers can be used, but only after washing hands. Also, make sure you do not leave your food out at room temperature for more than 4 hours, and that's between 41 and 135 degrees. And that's about it. Hope you have a safe day and make sure you keep everything safe as far as any kind of food. All right, back to the studio.